Welcome to the Bibliobazar podcast. In this episode, Dr. Paul and RN Nina take you through the topic of neonatal infections. This discussion is proudly sponsored by Nurse Unity Chats, connecting healthcare professionals for meaningful conversations. Let's get started.
So, have you ever wondered just how critical the first few weeks of a newborn's life are?
Oh, absolutely.
It's like a whirlwind, and neonatal infections play a huge role in that.
Yeah, neonatal infections are a big deal. Can you explain why they're so concerning?
Well, newborns have these immature immune systems, so they're super vulnerable to infections that might not affect older kids as severely. And these infections can be contracted before birth, during delivery, or even after they're born.
That's really alarming. What are some of the common signs that a neonate might be infected?
Oh yeah, so symptoms can include respiratory distress, like trouble breathing, temperature instability, irritability, poor feeding, and even failure to thrive.
Failure to thrive? That's when babies don't gain weight like they should, right?
Exactly. It's basically when they're not growing at the expected rate. And persistent crying or skin rashes can also be indicators.
Got it. So, what puts a newborn at risk? I mean, are there specific factors that increase the likelihood of infection?
Yes, definitely. Preterm delivery is a big one. Babies born early have less developed immune systems. Also, premature rupture of membranes.
Wait, what's that exactly? Oh, sorry, could you clarify premature rupture of membranes?
Sure. It's when the amniotic sac breaks before labor begins.
Okay.
That can let bacteria enter the womb, increasing infection risk.
That makes sense. And previous maternal infections can pass to the baby, right?
Yes, exactly. If the mother has an infection, it can be transmitted to the baby during pregnancy or delivery.
Yeah.
That's why maternal screening is so important.
Speaking of transmission, what are some common bacterial infections that affect neonates?
Well, Group B streptococcus, or GBS, is a major one. It's commonly found in the mother's gastrointestinal and genital tracts.
Right.
Mothers might not even know they're carriers.
So how do they prevent passing GBS to the baby?
They screen for it during pregnancy, and if positive, they give intravenous antibiotics during labor to reduce transmission.
Gotcha. What about E. coli? I heard that can be dangerous for newborns too.
Yes, E. coli is another one. It's also found in the maternal GI tract and can lead to serious issues like neonatal sepsis and meningitis.
Neonatal meningitis sounds severe. What are the long-term effects of that?
It can be really serious. Potential long-term effects include neurological deficits and developmental delays.
Yikes.
Early detection and treatment are crucial.
Are there viral infections we should be aware of?
Absolutely. Viruses like HIV, cytomegalovirus, and herpes simplex virus can all be transmitted from mother to child. Each has its own set of challenges.
For instance, how does neonatal herpes simplex present?
It can show up as skin, eye, or mouth infections, but it can also lead to central nervous system disease or disseminated infection. It's pretty serious.
How can we prevent these viral transmissions?
For HIV, antiretroviral therapy during pregnancy reduces transmission risk. For herpes, antiviral medications and sometimes cesarean delivery help. Prevention strategies are key.
You mentioned fungi earlier. Are fungal infections common in neonates?
They're more common in very low birth weight infants in the NICU. Candida species are the usual culprits. These infections can be quite serious.
And what about protozoan infections?
Toxoplasmosis, caused by Toxoplasma gondii, is a big one. It can lead to chorioretinitis, which affects vision.
Really?
It's why pregnant women are advised to avoid certain foods and cat litter.
Speaking of prevention, what measures can expectant mothers take to reduce risks?
Regular prenatal care is crucial. Screening for infections like GBS and HIV, staying updated on vaccinations, and practicing good hygiene all help.
Yeah, makes sense. Are there any controversies in prevention methods?
Well, some practices like using vaginal chlorhexidine washes haven't shown significant benefits in preventing GBS transmission.
Interesting.
So, not all interventions are effective.
That's good to know. How are neonatal infections treated when they do occur?
Antibiotics are the mainstay for bacterial infections. Early identification and treatment are vital. For viral infections, antivirals are used. Treatment can be intensive.
I've heard that overuse of antibiotics can be a problem. Is that the case in NICUs?
Yes, antibiotic resistance is a concern. It's important to use them judiciously to avoid promoting resistant strains.
Absolutely.
Stewardship is key.
What about the role of breastfeeding in preventing infections?
Oh, breast milk provides antibodies that help protect the neonate against infections.
That's
It's one of
amazing.
nature's best defenses.
Are there any cases where breastfeeding isn't recommended?
Yes, in mothers with HIV in resource-rich settings, breastfeeding might be avoided to prevent transmission.
Right.
Alternatives are considered then.
It's incredible how many factors play into neonatal health.
Definitely. And ongoing research is crucial to improve prevention and treatment strategies. We still have a lot to learn.
You know, I was thinking about the global impact. Are neonatal infections more prevalent in certain regions?
Yes, resource-poor countries see higher rates due to limited access to healthcare, screening, and treatment options.
That's unfortunate.
Efforts are needed worldwide.
It's a reminder of the importance of global health initiatives.
Absolutely. By improving maternal care and neonatal services, we can reduce neonatal mortality rates globally.
Yeah.
Every effort counts.
Thanks for shedding light on this critical topic. It's been really insightful.
My pleasure. It's so important to keep these conversations going.
Definitely.
Together, we can make a difference.